Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Radiotherapy, or it's not radiotherapy. Okay, radio iodine therapy. So in the radio iodine therapy, post operative, we can give post operative radio iodine therapy can be given to the patient. Why? This post operative radio iodine therapy will actually prevent the recurrences, or not actually prevent, they will reduce the recurrences, and they will provide the small improvement in the survival. They will also cause small improvement in survival of the patient, especially in the low risk patient. Then if the patient has metastatic differentiated thyroid carcinoma, in metastatic differentiated thyroid carcinoma, this can be treated by the iodine therapy. This is mainly treated by radioactive iodine therapy by iodine 131. This iodine 131 can be used to treat a metastatic differentiated thyroid carcinoma. Then the radioactive iodine therapy also treats, it is used for the treatment of almost 70% of the lung metastasis. 70% of the lung micrometastasis can also be treated by the radioactive iodine. Then so this is one more important indication. Then, but before we give radioactive iodine therapy or radioactive iodine scanning, T4 therapy should be discontinued. It is important to discontinue T4 therapy before, for almost 6 weeks. You should discontinue T4 therapy before 6 weeks, for 6 weeks before giving or before scanning with radioactive iodine or iodine 131. And during this period, because T4 therapy is discontinued, but we cannot leave the patient not giving any thyroxine hormone for 6 weeks, so patient is put on, or patient should receive, he should receive T3 therapy during this period, mainly to decrease the chance of hypothyroidism. So T3 therapy is given during this period to decrease the chances of hypothyroidism in the patient. Then we should also give low iodine diet is also given for a period of 2 weeks before the therapy. Before iodine 131 scan, we should give low iodine diet is given for 2 weeks. Then you will have to screen the patient with a screening dose of almost 1 to 3 MCI or millicurie of iodine 123, and you will have to measure the uptake almost 24 hours later. You will measure the uptake. Then after total thyroidectomy, this value of, that is uptake of iodine 123, will be around less than 1%, and there is a hot spot is seen in the neck. Normally, a hot spot is seen in the neck normally, which is residual normal tissue in the thyroid bed. So, hot spot in the neck. After initial screening, if you find out that there is a hot spot in the neck, so this is nothing but the residual thyroid tissue, residual normal tissue, which is present in the thyroid bed. But think that if there is significant uptake of around, if there is significant uptake, then if there is significant uptake, then you should give a therapeutic dose of iodine 131 is given with 30 to 100 MCI. 30 to 100 MCI therapeutic dose of iodine 131 is given if there is significant uptake. This is given for low risk cases. For low risk cases, you will give a therapeutic dose of iodine 131 is given at the dosage of 30 to 100 mci for low risk cases, whereas therapeutic dose of iodine 131 is given at the dose of 100 to 200 mci for high risk cases. So this is very important. This is therapeutic dose which should be given if the patient has significant uptake of iodine 123. Right. If the patient if the patient shows positive scan, patient has, so now the patient has, now second scenario, we'll see second scenario. Here the patient has positive scan, and along with that the serum thyroglobulin levels, if you measure, the serum thyroglobulin levels were found to be more than 2 nanogram per ml. Actually, normally the thyroglobulin levels should decrease. So if you see, normally after the surgery, the thyroglobulin levels should decrease. Okay, thyroglobulin levels should decrease, which shows that there is good therapeutic benefit. But if thyroglobulin levels are increased, and with positive scan, that is there is radioactive iodine uptake is present, along with that the serum thyroglobulin level is more than 2 nanogram per ml, then iodine 123 treatment is given after 6 to 12 months. Sorry, normally after iodine therapy, not surgery, after iodine therapy, that is iodine 131 therapy, the thyroglobulin levels will decrease. But if it is a positive scan and if thyroglobulin levels are more than 2 nanogram per ml after the therapy, then iodine 131 treatment is given after 6 to 12 months. Then you can also do a follow-up therapy should be done. The follow-up scan is done after hormone withdrawal. You can do a follow-up scan can also be done. So these are the important points about radioiodine therapy.
Thank you and thank you for watching.